Good morning, friends. I'd like to talk about PSA today. It's very important to men, especially with this being November. That's why I'm trying to grow a mustache. Pass it around. Tell people to get men to get a PSA test. Doesn't matter if they're 40, 50, 60, 70, whatever. Just get it checked. It's a simple blood test. It just give you an idea. Now, what I understand, what I believed, that they told me that anything above a 4 is seriously should be looked into for cancer. I see some places now talk about being above 2, but you can say, believe me, I'm no expert on anything. I've been going through this. I did a lot of research at first, and then I backed off and didn't want to get involved. I didn't want to even talk about it. I didn't want to even think about it because that wasn't who I was. I'm not cancer. But I want to talk about it a bit today. I want to talk about 3 different things that's on my mind. Basic PSA, PSA Bounce, and biological recurrence. I'd like to do those a little bit on each. I don't know a lot, so hopefully you can fill in the gaps in the comments. First, I'm going to talk about my PSA, so that's where I stand, so I know how it works. April of 2023, my PSA was 878.7. Now, 1, 2, 3, within 3 months, they had it down to 10.63. 1, 2, 3, 4, 5. Now, 6 months later, so that's 10 months since when I started, it got down to 5.7. Now, this was strange. When I hit 5.7, 2 different doctors said to me that don't expect it to go any lower. And I didn't understand why. They didn't even say why. And then I started looking it up, and I was seeing all these people that were having undetectable, and I couldn't make sense of it. And it took a long time for me to understand what they were saying. Is because my cancer was so advanced, and I had so many lesions, that they didn't expect it to go any lower. But, God was on my side. It continued to decrease. It did bounce up and down. It wasn't a perfect smooth, like it would go to 4, then it would go to 3.6, then it would bounce back up. It did this like a little gradually bouncing back and forth as it went down. I finally got down under 1. Oh my, how far away was that? When did I finally hit under 1? July. A year. 1, 2, 3. A year and 3 months. I finally broke and got 0.843. And I hit my lowest point, which is very odd when I look at it. It was exactly 2 years once I started. I went from my highest to my lowest point in 2 years. 1, 2, 3, 4, 5. Now, 5 months past that point, I'm back up again. It's been a gradual increase for the last 1, 2, 3, 4, 5, 6 months. 5 months has been a gradual increase. So 1, 2, 3. Not quite doubling in every 3 months. And I've been on ADT, I've been on abiraterone, I've been on Zoladex, prednisone, temozolin, I don't remember, morphine, hydromorphine, all this stuff. And I don't think we call this a bounce. I've talked to, on messages, I watch other videos, I watch a lot of comments, and a lot of people have a bounce after they have had a treatment, especially radiation or had their prostate removed or something like that. Often, not always, but often they'll see a little bounce. I don't know what bounce means. I don't know how high. Does it go up a few numbers? And I don't know how long it stays up. How do they know it's a bounce instead of a recurrence? PSA is scary for us. If you watch the numbers, it'll drive you crazy. The thing is to not let it control your life. It's scary. It is when you watch them and you're worried. Well, if you're living on the edge watching every time you have a blood test. I mean, I went through almost a year of having them every 2 weeks. But since then I've been every month. And then I only heard recently in this biological reoccurrence. Now, I'd like you to let me know in the comments if I'm wrong, because this is what I understand. I'm not sure 100%, but this is what I understand. That these people that are having biological reoccurrences is because they were taken off some of the ADT. And like I say, this is where I'm not sure. I want you to let me know. It's the PSA numbers came up, but sometimes they do a scan, but there wasn't showing any new growth of cancer. Let me know if I'm right or wrong on that. And then they'd start back on the ADT, and the numbers would come back down again. I'd like to know about that. Does that seem right? Is that, am I getting the picture right? And I think everybody should be checked. Even if there's not a history of it in your family, I think you should get a PSA check done. Just a blood test, a simple to see where you're at. And then maybe 3 months later or 6 months later, have another one just to see if the number's going up or going down, what's going on, to give you an idea. But if you've been diagnosed, it gives you an idea what's happening. And I don't know, like everybody's a different situation. Some people don't have pain. Some people don't have side effects. That would be wonderful. I just want to keep you guys encouraged not to be scared of these blood tests and the results as they come in. Sometimes it means for me, I got to crack down a little harder. I got to watch my diet. I got to eat a lot more herbs, try to keep physical. I just want to let you know that there's hope out there. I mean, God can do miracles, and he can give us more time. He keeps us encouraged, gives us that strength, that outward outlook. I've got just a wonderful outlook that we can continue to strive and have a wonderful life and not have this burden over us 24/7 that it puts you into depression and you don't feel like doing anything and you just say, poor me, what's going to happen? No. As a person I heard once say, what would I do today if I was well? And try to do it. And don't get discouraged if it takes a little longer, if it's a little more of a struggle. I just want to encourage you guys to understand that, we have to fight back. This is a battle. And we can't do it on our own sometimes. We need help. And I pray to God to give me strength and Jesus to watch over me. I have done everything the doctors have asked to a point. And we'll see where it goes from here. And they never believed I'd live this long, and I'm still kicking and going. I know a lot of you guys, I see some stories out there, and you've been at it for many years. And I'm impressed. and I am impressed. I look up to you guys, and come on, can we be, you know, help somebody else look up and say, okay, I'm not putting up with this. And thanks for listening to me, guys, and continue on with your battle. Don't give up. Take care, and God bless you.